Welcome everyone to this webinar on Maharishi AyurVeda Aroma Therapy and the unique methods that we use in this technology of consciousness of Maharshis. And today we will also have a very special guest whom I will introduce later for a very interesting and special topic. So I want to warmly welcome everyone. And we have only 1 hour to cover a lot of information and to give you a lot of knowledge. So let's jump right in and start defining what Maharishi AyurVeda Aroma Therapy is and how it works and what the method is. So I want to start off by showing you a presentation. And here we are. So Maharishi AyurVeda Aroma Therapy is aromatherapy based on Maharishi Ayurveda. And today I'm going to explain to you the guidelines that we follow to select essential oils. Because Maharishi Aromatherapy is not practiced the same way as conventional aromatherapy is. So, sorry about that. I moved my computer. So the first thing to understand is that Maharishi AyurVeda Aromatherapy is based on the time-tested, personalized approach of Maharishi Ayurveda that doesn't focus on just treating disease, but on addressing the person as a whole, and also taking into account the unique features of everyone's physiology and psychology. But let's start off by talking a little bit about aromatherapy in general and its physical, mental, and emotional effects and how comprehensive and holistic this science is. Here we see a picture that represents the limbic system in our brain. So the limbic system is this central area of the brain that you see here in colors surrounded by the cortex, which is all in pink. So the blue and the purple and the orange and the darker pink are different structures of the brain that comprise the limbic system. And the limbic system has a special significance here because an effect on the limbic system means physical, mental, and emotional effects.
Ich habe jetzt gerade einen Kurs.
Okay. Can you hear me?
Also, ich habe die Zeit ein bisschen verpeilt.
Hildegard, do you have your microphone open? Thank you. So it all starts off, as you see here on the left side, the bottom left side, the bottle of essential oil, just giving off the aromatic molecules and spreading them into the air, and then they travel up the nasal cavity and are perceived, and this means that the chemical molecules that comprise the aromatic molecules, they are bound to special receptors in the filaments of the olfactory nerve. And this is how they travel up the nasal cavity, and they travel up the olfactory bulb, which you see on the left-hand side, the upper left-hand side, and through the olfactory bulb to the limbic system, which then will have a number of effects. Because these aromatic molecules are made of chemical compounds which are very, very small, and have a special kind of configuration. They cross the blood-brain barrier, which is a barrier that exists to protect the brain from any harmful substances. But these substances, they cross that blood-brain barrier, and lucky for us, because they have healing properties and nature is perfect, so it only allows substances that are of a certain type, like these aromatic molecules. And this is how, through the sense of smell, the brain receives their effect, and this will affect the whole physiology, as we will see. So the limbic system will have an effect on the autonomic nervous system, and this means the unconscious functions of our body. For example, heart rate, blood pressure. We don't have to decide that the heart has to pump. It just does, and this is controlled by the autonomic nervous system. And just the same way, breathing, blood pressure, etc., are unconscious functions that we don't have to worry about. They just happen automatically. But besides that, it also controls cognitive processing and also processing of attention and emotions. So as you can see, you have physical features like heart rate, blood pressure, breathing, but also mental functions like cognitive processing and attention, and also emotional, the emotional side of it, the emotional processing. It also affects memory. And actually, the limbic system is the seat of memory in the brain. And it then is responsible for spatial and long-term memory, emotional memory, and smells can often be related to emotional memory. It's also the seat of emotions such as anxiety, aggression, fear conditioning. So it controls all of that, including how we actually control our reactions, our emotional reactions, and don't express aggression and don't feel fear. And it regulates the autonomic nervous system via hormone production and release. And this will affect those same features we already talked about, like blood pressure, heart rate, and the circadian rhythm, the sleep and wake cycle. So circadian rhythms have been very well known by Ayurveda for thousands of years. When we wake up, when we go to sleep, when we feel hungry, this is all part of the circadian rhythm. It also controls our system of rewards and addictions, whether we get addicted to something. So as you can see, there is a very wide array of functions and effects, and all of this can be affected by essential oils through their effect on the limbic system. And all of this and much more, and as we will see. So from this, we see that smell is an integral part of our metabolic system. So the limbic system, for example, secondarily affects and regulates hunger, thirst, etc. So I told you that it regulates hormone release and production. There is a hormone which is called the hunger hormone by the name of ghrelin, and essential oils can lead to the secretion of ghrelin, which means that now we become hungry. And smelling digestive essential oils, and there are many, will start then a number of processes in our body that prepares the body for the consumption of food. And it's been found through scientific research that healthy weight levels correlate with normal olfactory function. So if your olfactory function is normal, your weight level will also be normal. And just a note on that, that scientific research also indicates that some smells decrease appetite, which is why some essential oils can be used for overweight. So they can be used to enhance and appetite and improve digestion, because that's the goal. But they can also be used to regulate appetite when there is, for example, overcompensation of emotions through eating. So we have seen a lot of physical effects and also some mental effects. But in terms of emotional health, essential oils also have a number of characteristics, and each essential oil is unique. Some are natural tranquilizers, for example. Some are antidepressant or combat stress, anxiety, depression, shock. They can ease sleeping problems, and it depends on which essential oil we're talking about. Some essential oils are energizing and some are calming. So some of them promote calm, confidence, joy, peace, happiness, emotional balance, relieve melancholy, and relieve grief. And they can be uplifting, inspiring, balancing, and harmonizing. So all of these aspects and much more in terms of emotional health can be promoted through the use of essential oils in a therapeutic way. Now, how does Maharishi AyurVeda aromatherapy differ from conventional aromatherapy? We follow a set of guidelines to select the essential oils in a personalized way. And this is the main takeaway from this. So in our foundation course, which is the course that starts now on the 9th of May, you will learn the guidelines to select the essential oils and a lot more. And you will practice. I will give you an idea just overall what these guidelines are. And you will learn the method step by step by step by doing exercises. So we gradually learn. Now you start with the first step, now the second step, now the third step. So just to give you an idea, I'm going to go through each of the steps and show you the support material that we use and that you receive when you take the course. So we start off with the questionnaires, the health and the AMA questionnaire and the well-being questionnaire. And I'm going to show you what these look like. And these are used, the health and AMA questionnaires are used to assess the person's dosha predominance and the level of AMA. AMA is a term in Ayurveda that denotes, loosely translated, toxins that accumulate in the body and that lead to disease. So we want to reduce AMA. We want to reduce these toxins. And the well-being questionnaire is one that someone fills out when they have some specific complaints, some health problem that they want to address. So this is the Maharishi AyurVeda Health Questionnaire. I'm going to go back to this a little later, but just to give you an idea, it has 20 questions and a few more for ladies who still have their monthly cycles. This is the AMA questionnaire. And at the end, you add up the totals and then you know if the person's AMA level is high, medium, or low. And this is the well-being questionnaire where you describe if you have any health concerns, what you want to improve, etc. So based on this information, you prepare. You prepare to give recommendations. So you use the completed forms that I just showed you. And from the health questionnaire, you have the dosha scores, and then you know which doshas predominate for each person. And from the AMA questionnaire, you have the AMA score, and then you know if the person has medium ama or high ama, and what to do and then you can devise your strategy to reduce ama. You also consider the health concerns, what the person wants to improve. And now we start with the steps that you follow to select the essential oils according to the doshas and to the health concerns. So then we use 9 resources, and these are things that you have when you take the course. You consider the questionnaires that we already saw, and you use the booklet, The Power of Essential Oils, which is a very important reference material during this course. It was written by Dr. Rosie Gilvink, who was the pioneer of Maharishi Ayurveda Aroma Therapy. And this is what this booklet looks like. It's a small booklet. And you then, and I'm going to show you the sections of the power of essential oils and how you look it up. But you also use the chart of essential oils and their dosha specific action. Because just like anything in life, essential oils affect the doshas, vata, pitta, and kapha. Therefore, you need to know what is the dosha effect of each essential oil. And this is what that chart looks like, essential oils and their dosha specific action. And there are many different kinds of effects on the doshas, and you will see an example later on. So now you have found a list of essential oils and the power of essential oils. You have looked up their dosha effects, and you have matched that to the first person's dosha predominance. You now need to see if there are any considerations for the essential oils that you chose. And each essential oil is unique, including unique in terms of precautions. So for this purpose, the reference material that is the most complete is the illustrated guide to Veda Aroma essential oils. Or there is a sheet in the handouts that everyone receives on the course that has also information on essential oil precautions for each essential oil, but also general precautions guidelines. So, for example, keep essential oils out of reach of children, take special care if using on sensitive skin. And then there are a number of considerations for very specific essential oils that we need to be more careful in terms of precautions because they're very powerful. This is the illustrated guide to Veda Aroma essential oils. We call it for short the Veda Aroma Guide. And it has information on how to use each essential oil, how to dilute each one, and any considerations, any precautions that you may need to take. And then we start to use a form that was specially created to serve as a step in the guidelines for selection to make your life easier and allow you to look at the whole picture. And this is the form, selecting the essential oils, where you list all the imbalances, the health problems that the person may have, like main health concerns, mental, emotional, physical. And in each column, you will add the essential oils that you are considering. For example, if you had here in the first line migraines, you would see which essential oils have the right dosha effect for this person and address migraines, and you write the name of the essential oil here. And then, you list all the symptoms, and you see when the essential oil addresses the symptom, you write it here on the line that corresponds to the health problem. We will see an example of this a little later. So in the power of essential oils, you have two main things: the description of each essential oil and its properties, and the list of imbalances under each of the physiological systems. So nervous system, respiratory system. Under nervous system, there are a number of imbalances, and the respiratory system, other imbalances. So you look up, for example, if it's migraine, like I said, you look under nervous system, headaches, and migraine, and you see which essential oils address this issue. And then after that, you may come up with a list of essential oils that have the desired dosha effect, and you will look under the description for each essential oil and see which other symptoms it also addresses. And then, so back to our form selecting the essential oils, you have migraine, you have insomnia, you have different things here, and you see, oh, this essential oil addresses migraine. It also addresses insomnia, and it also addresses this issue and that issue. And you do this for a number of essential oils to see which essential oil addresses the most health concerns for this person. Then if you're going to use a method that requires dilution, we have a dilution sheet to make your life easy. So if you have to dilute at 1%, you just look up at the table and you know 1% means 1 drop of essential oil in 1 teaspoon of acaria oil. Acaria oil is a vegetable oil. So then you know that makes your life much simpler. If the essential oil follows a standard dilution, say 3%, that's 3 drops of essential oil in 1 teaspoon of acaria oil. So you just look up the table and you know exactly how to dilute. And of course, if you're going to dilute in acaria oil, we also need to know the dosha effect of the acaria oil. So we have this table of carrier oils, so almond oil, coconut oil, olive oil. You have all the dosha effects, and you match the dosha effect of the essential oil to the dosha effect of the carrier oil. And now you're ready to come up with a home treatment for the person, either yourself or somebody else. So this is the home treatment form. You add here the essential oils you selected. They're most suited for this person's doshas, for the level of ama, and for the health concerns that the person has. So say you added here peppermint, and it's for migraine. And then you explain, you choose the method and you explain here the method. And all of this we practice during the course. We learn how to use the forms. We learn how to give out the information in a concise but complete way and easy to understand, that anyone can understand how to follow the treatment. So the date is always very important because treatments have a period. So it may be 3 weeks of treatment and 1 week of rest, or it may be twice 3 weeks of treatment and 1 week of rest, or it may be 3 times 3 weeks of treatment and 1 week of rest. It depends on the need. So our Maharishi AyurVeda Health Questionnaire, just to give you an idea, has 20 questions. So for each question, you're supposed to choose the one that best describes you. The first column is Vata, second column is Pitta, third column is Kapha. It has 20 questions, except for ladies that still have their monthly cycles. In their case, there are a few additional questions. But for men and for young ladies and very young ladies and older ladies who are in menopause, we consider 20 questions. And in this case, we have a total count here for each column for Vata, Pitta, and Kapha of 677, just as an example. In this case, and we learn how to do this, we learn how to assess based on the scores, what is the person's predominant dosha or doshas. In this case, this is Vata, this is Pitta, this is Kapha. This person is a Vata, Pitta, Kapha. And now let's consider a list of essential oils and their specific dosha effects and see which ones are most suited for someone who is a Vata Pitta Kapha. So balm, Melissa, and these are the scientific names, by the way. They are important so that you know that this is the correct essential oil. So balm, Melissa, reduces Vata and Pitta. That's its dosha effect. It reduces Vata and Pitta. So for someone who is Vata Pitta Kapha, reducing Vata and Pitta is a good thing so that they don't accumulate and lead to Vata Pitta imbalances. Cistus balances Vata Pitta and Kapha. It's tridoshic, so very well suited for someone who's a Vata Pitta Kapha type. Cypress balances Vata Pitta Kapha, so again, perfect for this person. Now, Davana reduces Vata and Pitta but increases Kapha. So not the best option for this person because this person is a Vata Pitta Kapha and you don't want to increase Kapha. Neroli, same thing, reduces Vata Kapha. Now, this one reduces Vata Pitta, this reduces Vata Kapha, but increases Pitta, and you don't want to increase Pitta in this case. And Osmanthus reduces Vata but increases Kapha, which you don't want to increase. So for this person, if you were considering a list such as this, you would consider balm, cistus, and cypress because it's the desired dosha effect, and you would not consider Davana, Neroli, and Osmanthus, even though they may address the symptoms, but they are not the right dosha effect. Now, a next example is scores of 7, 13, and 0, which means 7 Vata, 13 Pitta, 0 Kapha. This person is a Pitta Vata. So the same list will apply very differently for this person. This person is a Pitta Vata, so reducing Vata and Pitta is good. Balancing Vata Pitta Kapha is good. Reducing Vata and Pitta is good, and increasing Kapha is okay because this person has a 0 Kapha score. So if you increase Kapha, that's not a bad thing at all. Now, in the case of Neroli, it reduces Vata and Kapha but increases Pitta, and this person is a Pitta Vata, so you don't want to increase Pitta, so you would not choose Neroli. And Osmanthus decreases Vata but increases Kapha, and that's okay. Decreasing Vata, increasing Kapha, no problem. So the list you end up with for someone who is a Pitta Vata is completely different than for a Vata Pitta Kapha person. And that's how you personalize the treatment for each body type. So in summary, the method consists of considering the properties of the essential oils. Each essential oil is very unique in terms of properties. You consider the imbalances, you consider the level of ama, and you consider the dosha effect, very specific for each essential oil. You consider any precautions for each essential oil, which is also very specific. You consider what is the dilution rate and dosage, which we also learn on the course. We learn about dosage. If you're diluting in a carrier oil, you choose the carrier oil also according to the doshas, and then you choose the methods of treatment. And we also learn about methods of treatment on the course. So all of this you will learn on the foundation course. You learn step by step by step. You practice the first step, the second step, the third step, and in the end, you are capable of coming up with a whole treatment and a very holistic treatment. And just to give you an idea of the properties of each essential oil, let's just take balm as an example. On the physical level, balm is an excellent tonic for brain, heart, uterus, liver, and gallbladder. It eases hypertension, palpitations, migraine, allergies, menstrual and digestive problems. On the mental emotional level, it is balancing, soothing, calming, uplifting, beneficial for insomnia, nervous tension, mental fatigue, overstimulation, and stress. It dispels anxiety, depression, melancholy, irritability, grief, hysteria, anger, and shock. And for skincare, it's effective for herpes, acne, allergies, itching, and insect stings. The benefits of essential oils for skincare are very well known. They are excellent for skin problems and very effective. And as you can see, one essential oil covers a very wide array of symptoms, which is why we use the form selecting the essential oils, so that you list all the symptoms and then you see which of the symptoms the essential oil covers. So I want to show you an actual form so that you can see how this applies very specifically. So one of the persons who applied for the webinar, she was the first one to apply for the webinar. She gave me her information so that I could show you how this applies in practice. So the first 3 people, as we promised, they will receive a free recommendation, which they will receive by email. So this, in this case here, is a lady. She is 43 years old. She's a Pitta Vata. And her main complaint was dysmenorrhea. Dysmenorrhea means irregular menstrual cycles. So sometimes she has, sometimes she doesn't. And she's 43 years old. She didn't complain about menopausal symptoms, but the dysmenorrhea may be a sign that menopause is on the horizon. So just as prevention and just to show you that the same essential oil can address both issues. And she told me that every year she does a little detox to prevent accumulation of ama. So then I added something for her to help in this regard to prevent ama buildup. And she has been going through a period of loss of near and dear one. So I added an essential oil for grief, just to show that essential oils also can help with something like this, which tends to be a very long process, long healing process. And there are ways in which an essential oil can help you, help uplift you, and help you overcome something like this more easily. So we see here that essential oil of rose distilled, because there are different essential oils of rose. It can address at the same time the dysmenorrhea. It can act as prevention for menopausal symptoms, and it can help with grief. Roman chamomile can help with the first 2 problems. And in fact, it's quite an uplifting essential oil. It could also help with grief, but this is not included in its description. That's why I left it this way. But from personal experience, I can say it's a very uplifting essential oil as well. And anise is an essential oil that can be used for reducing ama. And it also helps with dysmenorrhea. It can also help alleviate menopausal symptoms or work as prevention against them. And marjoram is an essential oil that helps to reduce ama, and it can also be beneficial when someone is going through a grieving process. So if I were to choose 2 essential oils for her that address the most symptoms, it would be rose distilled and marjoram. And with only 2 essential oils, she would have a complete treatment. So I'm not going to show you the rest of the analysis. I could show you as an example. I'm just showing you the 4 best essential oils, but you consider other essential oils as well, and you see how many symptoms they address, and you choose the ones that are the best. Okay, let me just check in the chat because I need to give the floor to Danny next. Oh. So if you have any questions about this specifically, there are no questions here. So I want to introduce Danny because it's a very precious opportunity to have him here talk to you about the prospects in terms of professional practice for aromatherapists and how an aromatherapist can work with health professionals and not only help a wide array of people and different kinds of patients, but also help spread the knowledge and have more people benefit from this wonderful technology of consciousness. So we will hear from Danny now in the sequence, and you will see now, now we saw how holistic this science is and the wonderful benefits that it brings. And we will now move on to talk about how needed this knowledge is in terms of promoting health and how you can succeed in bringing this knowledge to others by working with health professionals. So Danielle Seymour is a long-time TM teacher and has been working with Raja Louise many times on many special projects, also teaching advanced techniques. He's also an advanced technique teacher. He's a very knowledgeable and competent aromatherapist and has been for many, many years. He's a successful businessman. And in so many ways, he's very talented and skilled and successful. If I were to list for you all of his skills and experience and knowledge, we would be here for a long, long time. Just know that he is the creme de la creme in this area. So I want to give the floor to Danny now to tell you about practicing aromatherapy in different settings with other health professionals. So Danny.
Thank you. Thank you very much, Andrea, for this very generous introduction, but also for your admirable presentation of Maharishi Aroma Therapy and the process through which the students go in acquiring the knowledge and applying it to their patients, following the guidelines of Maharishi Ayurveda and helping patients go from, suffering to enlightenment. And really the reason for my talk today, I think you mentioned, was to inspire our newly people who are considering now to become consultant in aromatherapy, and also for those who are already experienced Maharishi Aromatherapy consultant and opened a new area, a new field. We've been so far, the college has been so far training Maharishi Aromatherapy consultants with knowledge of applying health, these principles to their clients. What the next step now is going to be, okay, how do we become more successful in spreading this knowledge, become known, and also start to interact with professionals in other industries? Because as you've seen, the scope of aromatherapy is huge, So the idea is that Maharishi Aroma Therapy consultant, is a professional with a great level of prospective clients, but we have to try and look at how to unearth those clients and how to attract them to us. And one thing that we've done is, and we're still doing it, is to structure the next module of aromatherapy to bring aromatherapy to the world by structuring steps in this module or how you can market yourself to medical doctors, for example, nurses, midwives, and all of that, and also school teachers to begin with. The idea after this module is that you will have a framework from which you can take knowledge in order to apply it even to other areas. And basically, that framework is an interesting thing because if we want to be successful, we have to become relevant, and and to become relevant and to stay relevant, we have to look at, okay, if what happens to a medical doctor, um, it's a very good profession, but if people are not sick, they're not going to go to the doctor. I've never heard of that. But they can go to the aromatherapist if they are not sick. Basically, because the aromatherapist is relevant all the time. If you look at the spectrum of relevancy in our case of Maharishi Aromatherapy, you can think of being relevant, let's say, in 4 areas, even though, yeah, in 4 areas. One area is perfumery. Another area is to relieve people from their symptoms. Another area is to create balance in the physiology, which includes relieving people from their symptoms, but from a Maharishi AyurVeda, point of view, to do that while creating balance in their physiology. And the other unsuspected area often is the area that has to do with how the essential oils can transform people's vision and perception of their own personal paradigm and help them go and eliminate the limitation of thinking that prevent them to see the world as it is, meaning in our perspective, to see that the world is really emanating from consciousness and is actually everything that is matter is consciousness. So you see, we are relevant at every step of the journey of people's from where they are to enlightenment, not just to relieve pain or to relieve any symptoms or to create balance in the physiology. That balance in the physiology can be taken and pushed to the extreme by favoring a style of neurophysiology and perception that helps the idea of consciousness being primary and consciousness is all there is. So going back to what we were just talking about, we could start, from perfumery to supporting enlightenment, from perfumery to supporting a consciousness-based civilization. So we we are relevant. So we were just establishing whether the aromatherapist is relevant, and we are relevant whether people have symptoms or not. It's just a matter of talking to the right um, professional that they will seek at whatever level of their development. And the idea here in our, in the course that I'm just describing to you is not only to promote ourselves as an aromatherapist, it is to accelerate our professional development by understanding how we can interact and having some tools that we are developing to be online because I've been practicing aromatherapy mostly in Mexico now, starting in France. And that was like in a world that was not yet completely online. So we're taking all of these tools that we used with medical doctors and midwives and nurses and bringing them online so that we could teach it to anyone who would like to work with us on that. But the idea is basically to take not the theoretical marketing approach of things, but things that we know have worked and transfer that to you in an organized way so that you could yourself test them, adapt them, and also report back to us on any success or any need for improvement and put the whole thing in the context of being relevant all the time and expanding that idea of collaboration with other professionals because those are the professionals that people know of. So even though they are not going to look for an aromatherapist, but through other professionals, whether they are in the medical industry, or in the education system, or in the hospitality industry, or in the cooking industry, the restaurant industry. Um, those are the professionals that people are in touch with. And at this touch point, we have to be present. And the whole course will be about how to be present at each of these touch points so that we could expand the knowledge of the professional and also open people to a new world that they have never thought of. It's really the Maharishi Ayurveda is the aromatherapy as you've never, heard of before. But the course that is being prepared with Andrea is the organizing power of moving this knowledge to the world through the different pathways that the world already know. Because one thing is to be an island and attract people to us, in our own practice, which is okay, that's also very valid. But the other thing is, how do we accelerate the adoption of essential oils in contexts that are maybe not so known before, or known but maybe not know how to articulate that and be present in these pathways. So, Andrea, basically, this is what I wanted to tell people that this course will be announced soon, I guess, and that it's really worth it to take the time uh, and study those aspects because in a world where we are interconnected, all of what we are going to teach has been proven, but in a world that was not interconnected, and now that the world is interconnected, things can accelerate our success because remember, Maharishi Aroma Therapy is part of the College of Perfect Health, and the aim is to contribute to a, a disease-free society. And to do that, we need to be integrated in society within, the noblesse of our own knowledge, but contributing to the pathway that society already has. So that's what we aim at sharing with you in the next installments of course. So, Andrea, back to you. I hope this has been useful. I mean, giving examples here is a bit tricky, just because an example is not going to give you the total aspect of things, but let's say that, you know, you want to talk to a medical doctor, the course will tell you, even sometimes give you idea of not a script, but main points of how to present yourself with the medical doctor. But also, you know, the idea of that is that not that the medical doctor necessarily will recommend you, because he has no interest in doing that unless he is in a in a framework of integrative medicine with you. But you will be able to tell the medical doctor without teaching him all of the 60 oils or so that you will be learning with Andréia, but you might be able to tell him about 5 or 7 or 11 oils only, not to saturate them, and how to prescribe that to their patients at every level of what we just mentioned, you know, whether it's for removing the symptoms or balancing the physiology, or even, you know, changing people's vision and perspective of their own world and paradigm and existence, right? So this is the type of thing we're going to do. And by doing so, they'll be having a better relationship with you, and and grow in their own consciousness and in their own aromatherapy in their own practice, and and gradually, you know, become a student of Maharishi Aroma Therapy through you maybe, and afterwards directly with the college, knowing that you'll be the center of providing solutions to these medical doctors and providing oils to these medical doctors. So that's a bit what I could say, Andrea, right now. I hope this is useful to everyone. Mm.
Thank you, Danny. Thank you. And I just want to add to what Danny said, that we are developing courses to train the Maharishi Ayurveda Aroma Therapy consultants on how to do all of this that Danny mentioned. So after you become a consultant, then you will receive training, this training that Danny is going to help set up for the consultants. You need to be a consultant. You need to know how to come up with the full treatment. For example, if a doctor wants to help a patient with pain management, so you can prescribe essential oils that are analgesic, that reduce pain. So, but like I said, there, and Danny has touched on this, there are so many different applications and so many situations, so many symptoms that we can help with as aromatherapists. So you do need to have the full training and the full knowledge on how to come up with a treatment for those patients. And what you will learn is how to work with the health professionals, medical doctors, for example, or midwives, or whatever, even in the hospitality industry. So in this case, you may not be treating health problems, but you may be giving beauty advice, and essential oils are excellent for this. So thank you, Danny. And I just want to also add, Danny has a lot of experience with this. So it's very lucky for us to have him to add this to the already very thorough training that the consultants receive.
Yeah, thank you, Andrea. And also to complete what you were saying, you know, it really, because yes, I forgot that they are present on this course. There are participants who have not taken the Maharishi Aroma Therapy course yet, the foundation or the consultant levels. But to tell you that definitely you can feel confident in starting a profession as or extend your existing profession to aromatherapy, because it is a field of knowledge. You have no idea the depth that, you know, essential oils can allow you to enliven in your clients and your partner's clients and patients. So with 2 feet and with all confidence, you can jump in. Definitely. Welcome. Welcome.
Yes. Excellent. So there's a few questions here. If you want to ask any more questions in the chat, you can add your questions. If you want to ask Danny any questions, please add them to the chat. Brian is asking, why did you choose marjoram over anise in that case? I chose marjoram because it was the perfect supplementary and complementary oil to rose, for example, because marjoram could be used for reducing ama and for prevention of ama buildup. And also it would help in the case of grief as well. Even though rose also addresses this issue, it's an extra support. So marjoram would be a perfect match with rose. But you could have gone with anise. Say you couldn't get marjoram for some reason. Anise also would be a good complement to rose, even though it doesn't address the issue of grief. But it doesn't matter because it also complements rose in the sense that it's also for ama. So it is another option. And sometimes you just have to make a choice yourself, after you do the objective analysis, use your judgment to see which one is more suited for that person. But you could have gone with anise as well. You would not have been incorrect if you chose anise. And Nelly is asking, I did course 1 with Nadine and 1 with you. I want to do course 2. We would have, I remember you, Nelly, we just have to see at which point of the training you finished to see what would be the continuation. So just send me an email and then I can look at your records because I don't remember off the top of my head. So see what will be the next step in your training. So jojoba oil is a good carrier for essential oils. Yes, it is. It is a very good carrier oil that balances the 3 doshas. So it's a very good carrier oil. And Brian is asking, does the course address issues regarding the protection of clients' data, please? Is this a question about Danny's course or the foundation course? We always, of course, protect the client's data, always. But I don't know how you would need special consideration for clients' data.
There are data laws in Europe and in
Yes.
the US, and you have to have systems that are compatible and proven in order for clients' information to be safe. So in
Yes,
the
the patient would
designing,
always have to agree that the information be shared.
oh yeah, that's one level.
Yeah.
But there are other technological level to make sure that it's not hackable, it's not shared, and the protocol to follow in which, we will see
Right.
in the course as well.
Okay. Very good. So what negative effects would have if use an essential oil only because of the smell? This is a very general question because essential oils are very specific in their action. We would have to see on a case-by-case basis if there would be any negative effect. The only thing I can think of is, for example, if someone has a pitta imbalance or a vata imbalance and you're using an essential oil that increases pitta or increases vata, then you will further aggravate the dosha imbalance. But inhalation is a very safe method in aromatherapy. In fact, it is the safest method in aromatherapy. I don't foresee any negative effect, but as with everything in life, everything is a matter of balance. So if you learn how to do this in a balanced way, there should not be any negative effect. Where can I access those forms? Will you provide to us in the training? Yes, all the forms, all the questionnaires are part of your reference material when you take the foundation course. So you receive the materials in your handouts, we call them handouts. And for the foundation course, you also need to acquire the booklet, The Power of Essential Oils, and the kit of essential oils, which is part of the training. It's very important that you start to get to know the essential oils, their smell, their effects. We will learn just a little bit of self-pulse diagnosis, and you will start to feel that when you smell the essential oils, they have an effect on your pulse. So the kit of essential oils plus the book, The Power of Essential Oils, these two together are part of your course materials, so you need to get that in time for the beginning of the course. So if you are thinking of taking the foundation course, you should apply as soon as possible and also order the kit with the booklet. You will absolutely need the booklet. And we are offering this time only. This is a promotion that we're offering only this year, 2025, that the participants of this free webinar who apply for the foundation course receive the Vidaroma guide free of charge. So the Maharishi College of Perfect Health would send you a Vidaroma guide free of charge, because you also need the Vidaroma guide. It has a lot of important and useful information that you need when you come up with recommendations. Does the training have a cost? Yes. Ricardo Fuge is going to show you a slide at the end, how you apply for the foundation course. There is a course fee, which depends on country. And she's giving you here in the chat the link to the application or the application form of the foundation course. So you can click on that link to apply. So Roll, she gave you the link here in the chat. You can click there and you'll know how to apply, and also what's the cost involved. And please bear in mind that the total cost means the course fee plus the kit of essential oils and the booklet, because those are an integral part of your training, plus the Vidaroma guide. But all of you, if you apply for the foundation course, will receive the Vidaroma guide from us. Excellent. So, oh, one more question from Jürgen. How long should should you expose yourself to the flavor of the individual oils? With some oils, I have the feeling that they have a fundamental effect after just a few seconds or minutes. Yes, this is true. The effect, especially of inhalation, is immediate, and it is there so quickly and so effortlessly and naturally that the effect has been created already before you even notice. So before, the prefrontal cortex is the part of the brain that will process information and will analyze, and is the part of the brain that you use when you go, oh, I was feeling anxiety and now I'm not feeling it anymore. Before this becomes conscious, the effect is already there. So the effect on the limbic system is immediate, like you said, a few seconds, a few minutes. For inhalation, we usually recommend 15 minutes, especially if you're using a microdiffuser. This can be done more than once a day. And the effect will be there quite quickly. Okay, excellent. Ricarda is also giving you the link to the course calendar of the Maharishi College of Perfect Health International, which offers courses in all areas of Maharishi's technologies of consciousness in the area of health. So here is the slide with the link to the course calendar, so you can check, including the other phases of Maharishi Aroma Therapy training, because after the foundation course, we have the consultant training phase 1, and then we have consultant training phase 2, and then you become a fully fledged Maharishi Aromatherapy consultant. Okay, excellent. If you have no more questions, we are at the end of this webinar. So if you have any further questions, you can add them to the chat. But I just want to say it has been a pleasure to speak to you. And I so look forward to seeing many of you, if not all of you. Some of you are already consultants. So you will not take the foundation course again unless you want to. But all of you who are not yet and who would like to start enjoying life in greater bliss in a simple, effortless, and natural way, I look forward to seeing you on the next foundation course, and all the consultants who wish to grow to higher levels of performance in this profession on the course that Danny is preparing for us. So thank you very much. Yes, thank you. It's been a pleasure. Thank you, thank you. And I hope to see you all again soon on one course or another. Please check out the course calendar that Ricardo just posted here for us. And I wish you a great rest of the day and a great weekend. May you, like Maharishi said, live in bliss and heaven on earth through the beautiful fragrance of flowers. Jai Gurudev.